Okay.
It's, you got to assess the situation and do what you think is the best at the time,
And again, with Dennis as well as John, we've both had the opportunity to interview them before, so I may have skipped some questions, or may be questions that this board has, but if it's all right, I'll ask you if there's any questions that you guys have for the candidate.
In your time in Warren, you've been there for quite a while, have you ever had to interact with the media at all? Or has it always been, because we're smaller here, and I don't know, I seem to remember Glenn interacting with the media once in a while.
Yeah, not very often, but I imagine it's happened once or twice.
The policy we got at the city of Warren, and I think it's a good policy, is we'll get back to you, to the media. I'll get back to you, but first I'm going to bounce it off the mayor, the supervisor, you guys, what the question is. How do you feel about this? I'll give you an answer, but it can be right now and stuff till we get the feeling of the people that the powers to be.
Fair enough.
Mr. Clark, as the assistant controller, how many people work for you during this time? I mean, today, how many people do you have working for you?
Well, in our department, we got
Ballpark.
1, 2, 3, probably 12 to 15 people that are there.
And as we've gone over at great lengths, in this department, there are 2 other people in addition to the finance director.
Right.
So this job will be, I would think, I don't want to make any presumptions. This job is hands-on, data, there's data input, a lot of the finance director is actually doing that work. The finance director is literally doing it. So I don't know how you might want to contrast that with maybe what you do today, and how you feel about something like that. I mean, we've asked that, but I'd like to even be more direct about it. That's what this job is. This is a day-to-day, hands-on job. And I had a chance to talk to the other individuals in the finance department, and they were very clear about the fact that they each have their own job, and the finance director has
It's his own job.
his own job. And one of the things I said to them is that, what would you ask if you were here? And they want to be sure that whoever gets that job understands that. And I don't think we expect that someone's going to come in and know everything about that job. I mean, it's not possible. But just an understanding that that's what it is.
Right, yeah.
So I would like you to just comment about that for a couple of minutes. You're going from a staff of 12 or 15, larger area, smaller department, hands-on. Tell me what you think about that.
Like I said, you got to learn the stuff before you can pass it down to somebody else. So if I'm learning and then doing it every day, I don't have a problem with that. I'd rather be busy than sitting around supervising or something like that. I'd rather have stuff to do. I know it's a learning curve between BSA and IDC, but I'm willing to take on the challenge, I guess, is what I should say.
Thank you.
All right.
Well, just to be clear, there's no passing it down. That's
Right,
the
I
point,
understand
right?
that, yeah.
Learning it, there's no, it's a grunt
Well, aren't you
job.
guys gonna
It
go
is
to
what it
100,000
is.
people here shortly?
You know, it's a grunt job. There'll
Yeah.
probably be things that the finance director does that you probably haven't done in 20 years. I mean, maybe not.
Yeah.
I would assume if you have 12 to 15 people, that are accountant one, they're the grunts.
Yeah, well,
You know,
we got a purchasing department there at Warren, which we oversee and, we deal with, the purchasing department handles the purchasing, but we still gotta follow the rules of the purchasing ordinance and stuff like that, so, we're involved with that, like, we'll say, nope, to a trustee, you can't vote on that because you're related to this bill being paid.
You're a
something like
vendor or
that. Yeah,
something.
Yeah, right,
Yeah.
your son works there or something like that, you should stay away from that. So we do have, we do deal with these different things. We deal with bank reconciliation, I deal with bank reconciliations when we have to, and stuff like that. But, I don't do it every day, I don't do it every day right now.
Right. And so I think that, and I really think, kind of to summarize it, one question the board has is, for example, are you capable of doing this particular task? And, you know, meaning, yes, I've done it before, or I'm familiar with it. And then the second one is, are you comfortable doing a greater variety of tasks that are probably smaller in scope than what you'd get? And meaning that there's a certain number of things that we do here that are no different than Warren, but
Right.
where the size of that task might be spread across two people, here it's one
It's you.
minor task for one person,
You,
right?
You know, I thought about that, and I wouldn't be standing here if I didn't think I was willing to accept that, because I would have told you earlier that
So you feel capable and you're ready for that if we were to extend that position?
Well, I guess that leads me to a question, if I may. What, you know, we had heard from the other candidate throughout the course of his conversation. What attracts you to this job? What is it that brings this to your attention and makes you want to do this?
And you're on film.
Well, it's closer to home, for one thing, for me. I look at it like I might be slowing down a little bit from what's happening at Warren, coming over here and doing a little bit of, like you say, manual stuff every day. I don't have a problem with that. You know, we got a lot of stuff is happening each day over at Warren that you're running around and doing, where I think if I was here, I would have a pretty set routine from what you guys are telling me and stuff like that, where I would be doing bank reconciliations on Tuesday or something like that, and maybe journal entries on Wednesday, and then if a problem popped up, is what I think what you're telling me, if a problem pops up, it's yours, baby,
Yeah.
and stuff like that, and then take care of it, you know, and stuff like that. So that's what I would expect from this job.
Thank you.
It seems to me like you'd have a lot more impact on what's happening here
Yeah.
than, I mean, just my perception, it seems like there's probably nothing in the accounting business that you probably haven't done throughout your career. And sometimes we all get into a career because we like a fundamental part of that job, and then you get into a larger scope, and you kind of lose touch with why you got into that business in the first place. And I think this position will probably bring you back to why you got into accounting in the first place. You have a larger impact, you'd be working with a smaller group, and maybe, like you said, your routine will be a little bit more predictable
Yep.
than running around and doing 20% of something every day and never really feeling like you're getting anything accomplished.
Right. I agree with you 100%. That's one of the things I looked at when I talked with Ken here and stuff like that, when we first started this out a couple months ago. You know, my wife says, I said, I don't know, I said, would I be bored over there? And she said, I don't think so, you know. And I think you're right. I don't think I will be now from, what everybody's saying here and stuff like that.
And I think it's worthwhile, we talked about it at the last meeting, but Dennis's youngest son and I think my oldest daughter were in the same grade in high school, involved in marching band. And during that time, we operated a bingo, and Dennis would chair the bingos from time to time, and my wife and I began to work because it's a fundraiser. So I met Dennis through that. That was really the only interaction or relationship that I had with Dennis. I think maybe Ms. Boyd dated my daughter once or twice. Later, Dennis prepared the tax returns for the band boosters. I don't know, I think you still do.
I did last year.
Yeah, yeah. Even though he doesn't have any kids in there, it's something that he continues to do. But, and on one particular year, there was a schedule that the IRS said, we've historically never asked you to fill this out, but you need to fill it out. And I'm not gonna call it a BS schedule, but it was a narrative. It was something to say, well, on this page, list things you do. Relative to, 5 accomplishments, or it was something that was verbal and not numeric or accounting based. So Dennis had contacted me because he knew that I was still involved in the program, and I said, you know what, I feel confident that I can respond to this IRS letter Because once I looked into it, what they're really asking for is not numbers from Dennis. So I happened to talk to him at that time, so I literally had his number in my phone. When we posted this position in the salary range that we did, what we found was that we had a very limited number of applications. I'd remembered that Dennis was with another municipality, and I guess if I'm guilty of something, I kind of recalled approximately what his age was, and I thought, well, I know that sometimes when you reach a certain number of years with a municipality, you can reach the point where you say, well, if I chose to leave, I go to work and they pay me $10 a day, but if I left, they'll give me $5 in a pension, so I'm really only working for $5. So on a long shot, I sent him a text because I had his number from doing the returns. He said I'd be interested. He came in and talked to me. After that, I'd asked him to come back for an interview, and that led to this. So I don't want you to think that, that there's been some recruitment, but like any of you might do, you reach out to some folks that you know, and I anticipated that based on his experience, and I did make some calls to references, like we did for both candidates to, before we, pursued the process. But in the interest of disclosure, that's how I knew Dennis, and that's the reason why I reached out to him when we were struggling getting responses. Or as much to say, the fella could say, hey, you know what, I'm comfortable with where I'm at, but we've got a young guy here that's really working out good, and he lives in your town, and he'd probably like the position. You just don't know, so sometimes you reach out to people that you know in the business. So,
Sure.
But having said that, I don't know. I don't mean to dominate. I don't know. There may be other questions.
Mr. Supervisor?
Yep.
Dennis, can you tell us about an initiative or solution that, or process that you developed to a non-traditional problem?
Think about that. I guess one of the problems that we already talked about was the 457 and the gentleman walking out the door. Well, we had to contact all 4 providers, have to send a letter to them, get me on the list of the passwords and stuff like that, so we could get into the systems when people were coming in to retire and stuff like that. Another one was when we set up the drug courts. I was the original person in setting up the drug courts and the reporting to the state and to the feds for them, because all our departments handle their expenditures and turn them into the controller's office. Well, we had to pull these expenditures out and classify them differently so we could file them with the state on their required forms and stuff like that. So we can get reimbursed from the state of Michigan and from the federal government. I don't know if that helps you with your question, or?
Thank you very much. I have another one if I could.
Okay.
Can you tell me about a time where you were asked to perform a task you didn't agree with? And how did you address your concerns to your management, or, how did you handle the situation?
I think I've stated that before. I said, I'll tell you what I feel, but if this is your marching orders, then we march along and get the job done.
Okay. And then one final one, sort of along the lines of the first question, but can you tell us about an initiative or let's say an innovative solution that you championed, so a solution or process that you've championed where you made the biggest change in an organization?
Well, when I started with Creative Risk Management and then it became CoreSource, we were very much in debt. Our CPA, our outside CPA, was concerned with keeping cash rather than paying off debt. So I would make an extra payment on a monthly basis to pay down the debt, and by the time 4 or 5 years came around, we were out of debt, and everybody was happier. Let's put it that way. and then the guy that owned all the stock in the place, we were supposed to be all millionaires by the time we were 45. He wandered off with quite a bit of money, and he's living in Palm Springs now. California.
Okay,
He had
great.
more stock than we did.
So he's the one who really made the big impact.
That's right.
So you created that innovative solution, and he
He put
Took
that
value.
project out there for me, I guess, to find the answer for him.
okay, great, thank you very much.
All right, any other questions? All right, do you have any questions for us?
I don't think so. I think you and Darren and Adam, who I met with earlier, have answered my questions that I had at the time. You were very informative, and thank you for this interview, I guess.
No, thank you, and I do remember I do remember one other question, and that was regarding notice. So-
Timeframe when you could start this position.
I would say I'd like to give the city a month notice. I think it's only fair. There's stuff that I work on that I would have to at least give to somebody else, you know, at least get a listing of projects and tasks and how they're done and how you enter into the computers and your passwords and get the password switched over and stuff like that. So I don't know if that's fair, but I think it's fair. Let's put it that way.
Understood, well, that's why we asked, right?
That's what we expect of our supervisory employees in the contract.
Yeah, actually.
It makes sense.
Yeah, it is, the supervisory contract, this is not a union position, but your peers that are union, we require a 1-month notice, so, or 30
Well,
days or something.
I think you need that,
Yeah,
to be truthful.
if you give people responsibility, right?
Yeah, you know, you're paying a person a fair salary, and they should be fair to you too.
Mhm.
You know, I know you don't have to stay where you want to stay, but I think you should at least be fair with the people
That's fair.
that you're being paid by.
All right, any other questions? No? All right, now, Mr. Huth, the deliberative process is, like the rest of the meeting, is open, so, I mean, at this point, I mean, both candidates are welcome to stay or leave, that's their business, correct?
Correct,
Right,
yeah.
so at a bare minimum, I think we should at least make sure that the other candidate's aware of that, and if they choose to stay, choose to leave, that's completely up to them.
Now, you've officiated sports for 30 years?
40.
40 years?
Yeah, I started in 1975 when I came out of college.
Well, now I have a question. Why is it, in your opinion, that the Lions keep getting so many bad calls? Because they are a winning team.
My son would say, I'm blind, I'm deaf, I wanna be a ref.
Well, they tell me,
I
they
don't
tell
think
me
I've
don't
heard that.
give up your day job and where's your dog sometimes, you know? But, I think the college, I don't know, I stayed up like a dummy. I stayed up last Saturday night and watched the last bowl game of the year. I think was it the Alamo Bowl? It was West Virginia and Arizona State maybe. And every replay, you could see the call was wrong, and it would get confirmed from the booth that the referees made the right call. And I'm going, is this guy drinking, during the game or what, and stuff. And I know Darren went over the DSL thing from last year.
We're still in,
To me, the best referee, sort of shot that I've ever seen anyone take, and I couldn't tell you the game. I might have even been, maybe a minor league, but there was a hockey coach, and he was angry at the call, and he jumped over the glass, and he took a stick and he busted it on the rail. And he was walking around, he flipped it over so the stick was on the, the tape was on the bottom, and he was walking around like he was blind, like, it was, to me, I thought that it was just to have the wherewithal to jump over the bench and pull that off. I thought it was hilarious. It was, and he didn't say a word, but it was, memorable, so. But, all right, well, good, well, thank you.
Thank you.
I'll tell the board that I also prepared one other thing. Actually, during the week, in conversation about this, I just came up with the idea to ask Andrew informally to contact neighboring municipalities. So I prepared a finance director comparison. 5 of our neighboring townships. I believe that at least 4 of them are union positions, they're contracted positions. So the finance director is in a contract, and they have steps assigned to that position. So in some cases, it's literally spelled out in a contract. And then also whether or not the individuals were a CPA or not a CPA, or if we didn't know. So not every one of our peers employ a CPA in that position, but some do. And of those, there's the various salaries listed. So during the, and it didn't come up through these interviews, but during the interview process, and I apologize, I thought it was 70 to 80. You said 65 to 80 was what the posting was? Or was it 70 to 80?
70 to 80.
I think it was, okay. So we posted for the, for this position, a salary range of 70 to 80,000. And we had a discussion with each candidate about salary. This is a non-union position. This is a contracted or individually negotiated position. John had said, I'm willing to start. I'd like an opportunity, but I believe that 80 is what I'm worth, and I'd come and prove myself, and I would expect that, in response, I'd be anticipating a salary at some point of 80, although I might be willing to start for a salary less than that. So, not to paraphrase or put words in someone else's mouth, but in the interview process, that's what we'd said. Whereas Dennis had come and said, well, the salary that I'm making at Warren is higher, however, I don't need health care, so I would entertain a salary that's higher, but it would be, in essence, a bundling of the cost of my salary plus health care, which was also one of the things that we discussed. So this, I'm going based on memory because it was almost a month ago, but I think we discussed that at our last board meeting of 2015. So we did discuss the salary issue. Each board member has now not only had a chance to kind of contemplate what we discussed a good part of a month ago, but also interview the individual candidates. I believe that the proposal at our December meeting was to extend an offer to Mr. Clark. And I can say that I think we had two good candidates here. It's still my preference as a board member to do that same thing. But as you know, that's not something I can do. It's up to this board to deliberate or make a motion or give some feedback based on the interview process.
Well, at our last meeting, I think, we sort of pushed this, and like I mentioned, I, like John, mostly because of Glenn, our old finance director, saying that he could just step in and do everything without, after reading this, step in and do the position with very little learning curve. But I'm just gonna go back to this other item with the healthcare. And we have certain items here that are just something that we do and they apply to everybody. And whether or not somebody takes health care, which I'm one of them that doesn't, we give $3,600. That's what we do. That goes across the board for everybody. And I am against giving the $20,000 or whatever in health care to an individual's salary. We don't do it for anybody else. It's been a policy around here for many, many years that we don't do that. And that's just my feeling. And on another note, we've never paid a finance director $100,000 or whatever that comes out to. I don't know the number that you're tossing around right now.
I didn't negotiate the salary. You'd have to ask Mr. Witt. Mr. Witt has the salary. It's not my position.
Okay.
I'm texting
I
the
didn't
next person that's
understand
gonna
that
come to the
question.
meeting.
I didn't know that was a question, sorry.
Oh. I didn't have a salary negotiation. Are we talking $110,000? Is that what?
No, I mean, the conversation as far as what he was looking for was in the range of $100,000, and whether you say that 20,000 of it's for healthcare or 3,600 of it is for healthcare, if that makes you more comfortable with it, and we could say, his you know, it's 99 and 3,600 for healthcare, and we'll take it down, so his salary is really, you know, 95,400 plus 3,600 for healthcare. I don't think that matters.
Okay, so that being said, we would be the highest paid other than Clinton Township at that point. And,
No.
well,
I was gonna ask the question.
okay, so by
on
your
this
own
sheet,
numbers.
Each one of these include benefits.
These
No.
numbers don't include the
No, they
benefits.
don't.
That's correct.
Cost of benefits, correct.
Right,
Correct.
the cost of benefits are not.
So these
That's
are all
correct.
strictly just salary?
Correct.
These are strictly salary now.
That is
Correct.
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 But top step, is that the most they can make, or is that current salary?
Those are, well, it depends, and and this is a good point, because what we talked about, and because as a comparison, some of the people that are literally filling these positions are at their top step. Some may be in progression toward that step based on the years of service or the time that they've been in that position. But as we discussed in the case of this position, we've discussed a salary range, where we discussed a top step, meaning one candidate said, I'd like to have my salary in this range. Another candidate said, well, you advertise 70 to 80. Hey, I'd really like the job, and I feel confident I can convince you that I'm worth the 80, but I would come in not anticipating that I was gonna get 80 6 years from now. I'd like to be at 80 by the end of the year. So I listed the top step because the number that we're using for comparison, in the case of the one candidate, would be 80,000. The other would be, I thought it was just short of 100,000, but it was close to 100,000.
I think that's what you have to do, what the top step is. I mean,
Right, that's
right,
why I
right.
didn't list all of the,
Yeah.
you know, maybe say these back up, you know, $3,000 a year for 2 to 5 years, you know. So I didn't list that because it varied from each contract. I was trying to give it a snapshot.
So I said this at the previous board meeting, and I will say it again. Being a steward of the money, I can say that probably both candidates can do the job. You know, I think both candidates can do the job. That being said, being a steward of the money, I'm gonna go for the cheapest position. That's, you know, and that would be John. John, you know, wants $77,000, and I think John's gonna be here a long time, and, you know, that's, once again, my opinion.
Okay.
And being a steward of the budget and the money, I need to get a job done, and I'm gonna try and get the best person for the cheapest price. That's where I'm at. And I'm gonna say this, you know, Washington Township 74, Shelby Township 90, Chesterfield 90, Macomb Township, we just went through all this with these salaries.
Yes, we did.
So if we're gonna start talking $100,000, I think we need to revisit this issue again, because it was clear from this board that these other communities were much higher than us because they were larger communities. And to hire a finance director higher than what these other communities, I think goes against our other talk when we were talking about our salaries.
Well, I see that of these 5, we'd be paying less than 4 of them and close to the 5th one. So keep in mind, right now, our healthcare costs are for single, 2-person, or family. That varies anywhere from, these are round numbers. I'm gonna say it's really 7,700, but let's call it 8,000, 15,000, or 20,000. So, single, 2-person, or, oh, I got a message that the camera is still pointed at the podium. So, someone is texting. So someone's watching. At any rate, so we're talking about anywhere from $8,000 to $20,000 added to each one of these just to provide salary and health care. So I can't look at a salary of $90,000 for 2 of these and ignore the fact that there isn't anywhere from $8,000 to $20,000 of additional expense added on there. So it's simply not a fair comparison to say that you know, we're the second on here. I would say no. I would not say that. This is a unique position. It's one that we negotiate for the individual. It's a contracted position, and I believe based on where we are today in our accounting department, you know, we're not going to replace the person we had. Keep in mind, we just posted for $80,000 plus benefits. We had, other than Mr. Clark, we had one other applicant that met our requirements saying, well, okay, I'll do it for 80. So presumably, the majority of those people are saying, I expect more than $80,000 if you want a CPA.
Mr. Supervisor, a couple of things, if I may. Mr. York is correct, and we've gone through this exercise where we compared ourselves to other communities, and we at least agreed, or maybe not everybody agreed, but we had a consensus that we needed to be conservative based on a variety of factors, whether it be our size compared to the other communities, financial condition, and I think that applies here. My first inclination is to say that if we have two candidates, as Mr. York said, that can do the job, my first inclination is that I would defer to the direct manager. If both candidates can do the job, then I would defer to the direct manager. I realize that this individual has to work with everybody, right? But I would defer to the direct manager, assuming we have two qualified individuals. In addition to that, I think we need to then look at the salary, right? So I hear what Mr. York is saying, but what I would say is a little different than that. I'd prefer to defer to the direct manager, but I also would say that I believe we need to be conservative in the salary. And that is that we pay our other department heads, and I understand that this, so we pay department heads in this, and I'm talking about building manager, fire chief, chief assessor, in the low 80s, right? And I get that we're asking for a CPA, a little higher qualification. But I would also note that of the communities here that we've looked at, 2 of the 4 that we know are not CPAs. So I spoke to Mr. Huth, this job doesn't necessarily require a CPA.
No.
But part of that falls into how they structure their departments.
Yeah, okay.
I mean,
I'll grant you that. So what I'm saying is simply this, that my inclination, if we have 2 qualified candidates, or a number of qualified candidates, is to support the candidate that the direct manager would like to see in the job, assuming that they're both qualified. But I would say that the salary I would support would be somewhere in the neighborhood of the mid-80s. I'll just call it out. We're paying our current managers low 80s. This may be a more qualified job, mid-80s. And I agree with Mr. York that if we're going to add a premium on for not wanting benefits, that we limit it to what we currently offer. And that's my position.
Well, there's a difference between a contracted agreement with employees who can enter or leave the healthcare program versus someone who signs a contract that says, I'm not taking healthcare. So let me say this. If every time we hired a new employee, that employee said, I will sign a contract which states that I will never accept healthcare from the township, it would be a completely different relationship than if I said, if you choose to opt in or opt out at your leisure, I'll give you this amount of money. And the only reason you give an incentive for someone to opt out, it should be, let's just say you have 2 working people, right? A husband and a wife, right? Ultimately, the best amount that we should offer for an opt-out is a little bit more than what the other employer offers. Because now that other employer is paying 20 grand, and we're only paying 3,600. It's the reason why we went from 2,400 to 3,600. So the incentive is twofold. One is it's to convince that person it's rich enough to get you to say, all right, I'm going to go with the other insurance plan, number one. But when you do so, you recognize that at any time that person can say, well, we've changed our mind, we're canceling and we're going with you. At that point, if I had the opportunity, I'd say, well, would you stay out for 4 grand? Oh yeah. Well, that's worth $400 more to not pay 20 grand. So that number is established based on what other contracts have. But make no mistake, when you're done, what we're proposing is if you say mid-80s, and I advertise, and as I told you and I've said to other board members, I'm not beholden to a candidate, but I'm trying to get to the point where if we do advertise, I'm not going to advertise again for 70 to 80. So what I'm going to do is I'm going to have to go some range higher than 80. Let's say it's 85. And let's say I find someone who comes in and says, yep, I'll take it 85, but my wife and I need health care, that's 15, so I'm at 100,000. Well, I just went through a whole exercise and I didn't save a dime. So I can cling to an ideal, but what did I save? This isn't a question this is truly a question of when you talk about money and comparables and everything else. I brought these numbers forward because it was a question asked of me. But what I can tell you is this, I'm not gonna advertise again for 70 to 80,000. It's a waste of time and it's a waste of money.
I
We
don't think
didn't get
anybody
any,
here, Ken, I don't think anybody here is saying, I don't hear anybody saying go out and advertise again. Maybe I'm wrong. I don't hear that. I didn't hear that,
okay?
but I would say,
So if I-
but
so then
wait
if
a
I
minute,
pay
but wait a minute,
80
if you
plus
really-
15
but
for
wait-
healthcare,
but wait a
where am I
minute,
at?
if
I'm
you
at
really- if you
95.
really wanna talk about, two candidates, and I don't mean any offense to anybody, right? I have one candidate that is doing this to make it his job for a living, and this is gonna be his only salary. Let's be honest, the other candidate has, he's gonna retire from Warren, he's gonna have a pension coming in now. that
Actually,
he
no,
doesn't
if you would have paid attention during the interviews,
I
he
did.
does
He
not
doesn't
have a
have a
pension
But
from
you
the
still,
city of
but you
Warren.
still have a 457 and this and that you can draw on.
So we won't hire candidates if they've saved money.
I haven't
You-
voted for one yet.
You got a bank account?
I haven't
You got any
vo-
money in there?
I have not voted for.
Probably shouldn't hire you.
I have not voted for a retiree yet.
No, the
And-
key
and-
is
and
the
I-
fact
and
that
I-
someone
and-
saved their money is a reason we
and-
shouldn't hire
I-
them now.
I can.
I'd hate to hire a financial guy, a guy that's in charge of the township finances that can't manage his own money.
It says I've never saved money for retirement.
You know what, Ken? I don't think I said that, Ken. I don't think I said that. I
No, you
think what I-
misconstrued the
I think-
facts
I
and said
think
he's
what
gonna
I
collect a
said-
pension.
Right.
So we tried to correct you after you misconstrued the facts to the people that are listening.
Right, there is no pension involved. This is a person who's
Well, it's a
working.
457. We went through that earlier. I get it. I understand that. Okay.
I've given the salary a lot of thought, from the last meeting until now.
Mhm.
And I was leaning towards a more conservative number before. And then I thought about Glenn, and Glenn had foregone a raise a number of times, and where his salary probably should be today. And if we take his salary and we add $3,600 for the healthcare, would it be fair to say that we're about 90,000?
Well, it's hard to say. I mean, it's subjective to say where would his raises have taken him. He
Well-
forewent, or he voluntarily agreed not to accept 2% raises.
And
I
I'm-
couldn't tell you the number of
And
them.
I'm just saying that because I was trying to come up with a basis on where the salary should be today, because I didn't know we were gonna get this other sheet.
Mhm.
And this other sheet is basically 3 of the 5 were about 90,000, so.
Plus
one's-
benefits.
Right. So I would be okay, somewhere between 85 and 90,000. I'd be okay with that, which is higher than us.
But then if it was
Originally.
85 and 90 with benefits, I mean.
That's too much.
But here's the problem.
Right, but how
That's
could we possibly advertise 85,000 and no benefits? We definitely aren't gonna get any other candidates for that.
I'm not suggesting that.
Okay.
I'm not suggesting that. I'm just saying that I'm suggesting a higher salary than I thought I was willing to do before.
Okay.
the-
Not a lot higher, but.
But I
mean,
think the two candidates before us are above that salary range.
Above
I
that
think
cost.
I think
Above that
$80,000.
cost.
I think $80,000 is reasonable
So, but
to start. I just do.
Mr. York,
sorry.
and
I don't.
just,
But is
and
that
I,
a-
but Mr.
is
York
that a
has said this,
$95,000 cost?
several times when we're,
And why
when we're
doesn't
looking,
somebody
hold on,
make a motion
when we're
and
looking
move
at,
on?
because we're trying to build consensus as a board, that's the way we work.
That's typically how we work.
As we look at other hires, I've heard it several times from the treasurer where he said, the starting cost of a firefighter is $30,000. Well, that's not the real cost. You gotta include their pension and their health care and all that stuff. That's the real cost to hire somebody. So if we're looking at somebody tonight and we're gonna hire them, to say, well, I'm really only comfortable hiring somebody for 76, but I don't know if the candidate has a family and all of a sudden that's 20 grand in healthcare. That's really $96,000 in cost plus the retirement stuff. So to say, I'm really only comfortable with 76, that's really not the full picture.
Right. You've
When
gotta
we look at the
full
other
cost.
side of this, the way, the recommendation that I made at the last meeting is, that's the cost. There's no health care. We put it into wages. So whether it's left pocket, right pocket, you're going to paying it to Blue Cross or paying it to the individual. It's taxpayer dollars and we're paying it to the to the employ that individual.
So, for example, another way to
I
look
guess
at it
my
is
point
right now.
You have a candidate here that's well qualified for $80,000 in single payer health care. I don't know how it can't be any cheaper than that.
Well, the single-payer healthcare
So-
could change, right? That, we don't know that.
I'm
Down
just
the road.
wrong.
So so if we're back to, my point being, I would prefer the candidate that is the preference of the direct manager, if they're both qualified.
I like John, and I have to work with the person on a direct basis.
And I said that, I said, we have,
I can
everybody
work
here has
with
to
either
work with them.
candidate.
Everybody here has to work with them, I do,
Right.
right? And so I think I'm gonna give up, this, my notion is the priority to the direct manager. I'm just saying that both qualify. Then why don't we then talk about, if we were going to do that, if they are both qualified, then let's talk more about the salary than about, right? Because I do agree that the healthcare cost built in is a cost. It just is. And so we hire somebody for 80 and give them $8,000 benefits, that's 88,000, period, end of story. We don't pay payroll tax on that part, so it's a little bit, not a lot. So why don't we talk a little bit more about the money then? I heard what Mr. Brado said. I think if we were going to be all in at 90, if you hired someone at 80 and paid them, you'd be at 90. So if we're all in at 90.
Plus or
now,
minus. Could
you
be,
know,
single is
agreed,
8,000, two is 15, family is 20.
So all I'm saying, and I'm,
And none is zero,
Right.
Well, and none is no cost, right?
3,600.
so everybody's,
But it isn't 30, I mean, and that's not,
No,
that's
that's not
what
my
we
point.
offer within a bargaining unit where people have
Right.
other motivations.
so all I'm
Keep in
saying.
mind that we don't have an unlimited budget here, guys, either.
Well, of course we
You know,
don't.
we-
But
we're-
even you would suggest that are we gonna hire somebody for less than 80,000 in benefits? Because I've actually gone out, I've gone out and I've done a little research on my own and looked into some salaries. And it would seem to me that the salary somewhere in that 80s range is what we're gonna have to pay.
Well, if all we
And-
do is take a look at what Glenn was making, and he ended at, I think he ended at around 75,000, 75,440 is what sticks in my mind, but
Right.
let's call it 75,000. He had, again, foregone raises.
Yes.
And if he had said, I'd like to stick around for 3 more years, I don't think we'd have been offered him 75,000. So let's say, all right, look, you know what, we're gonna bump you up to 80. And I don't know, it's hypothetical.
Understood.
Right? Which is still a pretty good deal, knowing that it's a known commodity. We're gonna give the man the same health care he received before, which was costing us $15,000. The real cost to have kept Glenn was $95,000. For those two components, that's what we would have kept to maintain the status quo. And I certainly wouldn't have said, okay, January 1, all right, let's talk about your contract, and hey, you know what? Sorry, we really appreciate the 2% you skipped all those times, even though it was in a contract. And we've given raises to every other bargaining unit and ourselves,
Well, we
but
did
you don't
at that
deserve
time,
it.
Ken, come on. That's
What's
not
that?
true. During the time that Glenn was not taking raises, the ASME union wasn't taking raises. the
Correct,
fire
but since
union-
that
no-
time,
nobody
since then,
was.
everybody has taken
Hypothetical
raises.
But no-
conversation
nobody
is
was.
as of January 1.
Correct.
Yeah,
The point is had Glenn
nobody
stuck
was-
around, he wasn't gonna, we
I
were
would
not gonna
agree.
offer him 75 grand.
I
That was my
tried
point.
to, I told him, we tried to get him to stay for 85, he wouldn't stay.
Okay, but let's say we said 80, and you threw 15 on top of it, you're at 95.
So-
We can
so-
slice it however we want, but it was a two-payer system.
Agreed.
We
So-
were not gonna get through 2016 without paying at least $95,000 to satisfy that position.
And so my suggestion, it's just this, this is a working session.
No question.
I've heard Mr. York say he can work with either candidate. That's what you said, right? So Mr. York also said it's a matter of money and the stewardship, and I agree with that. I do. So why don't we talk, and again, maybe we come to a compromise on that. And if that compromise is a certain dollar amount, and the candidate that is more preferable to Mr. Witt is not interested in that dollar amount, then so be it. I mean, I agree, I understand that there was an amount discussed, but now after the board meeting, maybe, we come up with a compromise amount and make that offer, and if that's not acceptable, then it's not.
Well, do you recall the proposed salary? It was a 3-year thing?
We had talked about starting at 99 and going from there. It was not a specific set in stone, and it wasn't, hey, will you do it for 99? It was, hey, what would it take to get you here? What would that number be? And it was a little that was the number he shot at me, and, you know,
I
I
also
don't think it's
believe
an
that we give,
unreasonable number.
what's in there, 10% on retirement too.
Well, that's what we'd be extending, obviously, a savings plan to either candidate. Like, no
Right.
different than what we said, do for the chief.
Well, no, I think it's, what is
Or
it,
Glenn.
10%?
I think it's higher than that. I don't
Might be
know.
15%.
No, I don't think it's that
12,
high.
13,
That's what I was gonna say.
I don't know,
12.
I don't know.
one of the two.
Yeah.
But those numbers are the same regardless of who we hire in.
Well, again,
Well, it
that's subject
scales
to
with, it
negotiation.
scales, so if you take the, if you take the healthcare and it's 20,000, now you're paying an extra.
So maybe why would we
$3,000
structure a
on the-
contract that
on
says
the-
certain part of it
yeah.
doesn't qualify?
Or
The-
you change the percentage.
Right, right, so.
So as an example, if we said, all right, well, we'll go, 97, 99, and 101, that averages out to be 99, right? And we offer that, and we say, okay, well, you know, we're a little heavy on that percentage, maybe we're in a position to offer, a slightly lower percent on the pension, on the savings contribution, to help with that, to help offset that concern.
Well, I just think there's a way to manage that. You know, if we put more of it into salary than benefits, there's a way to manage the contribution.
Well, and here's the nuts of it. If the board's not willing to spend, you know, I mean, as far as a concept to spend that much money on a person, I mean, if you guys said like, hey, here's what we want to spend, go negotiate a contract that costs that much, I'd be happy to do that. You know what I mean? Like if you give me, here's the cost for the position, I'd be happy to do that. I mean,
I think we
you know what
have
I
a
mean?
cost for the position. I don't even know how we went from 80 to 100. You know, I don't, we have a cost. If we go to $100,000 for salary,
And again,
look,
you're,
look,
you're,
I think
you're
that-
neglecting
and
cost.
I
You're
think-
you're
just hear
confusing
me out,
cost
Adam,
and salary.
Adam, I'm not confusing anything. This is what I'm not confusing anything, Adam. I get it. I understand about the healthcare. Trust me, I'm not a moron. Okay, I get you think I'm a moron, Adam, but I'm not.
Gosh, I
Okay,
didn't say
the
that.
simple fact is that I'm gonna get the candidate the cheapest price. And the candidate the cheapest price is the 80,000 plus a single payer healthcare at $8,000 plus the 10%. I don't care how you break up the numbers, till the cows come home.
So that's
You're
eighty-eight
still
thousand,
not
right?
getting
It's
to the, to
88,000,
the,
right?
to the 100,000.
It's 88,000.
Just
So
on
what
the
I'm,
salary.
what I'm saying is that as a compromise, to pick the candidate that Mr. Witt is more in favor of, the offer becomes 90,000 all in. I'm just asking that. And if
You
that's
know-
not acceptable, then, you know, it's virtually the same dollars.
Right.
And,
It sounds
and,
like we're all.
well,
in
you
agreement
know,
with it.
all I'm saying is that when I look at a negotiation, you know, there was some dialogue, but who knows what would happen if it now comes to a board motion that says, here's what the board is willing to do. What do you want to do, sir?
Right, but so what we have ascertained is that the current salary and compensation for that person, not including health care, is just about $100,000. So then you're saying to someone, hey, you wanna come take a $10,000
Right,
pay cut?
that's what we're saying.
Well, that's not gonna work, so we didn't look at it from that perspective, we looked at it as, well, since healthcare isn't a component, what can I include between salary and my cost of healthcare to basically fill the position at roughly the same cost that I would have paid had the prior individual not retired. And so my point is that we're looking at about a 95,000 plus or minus expense had nothing occurred.
Okay.
So my point is when I'm coming to this board to satisfy the need that we have, I'm thinking that I'm comfortable proposing to this board that we're in the $95,000 range if we do nothing. That's what we would have found ourselves looking at for 2016 in either case. So, you know, I recognize the discomfort associated with, well, the 36 versus the cost, or single payer, or family, or two-person. But when all is said and done, from my perspective, it's a pot of money. So if we approve a budget and we say, okay, well, we'll approve this budget. And we say, well, you know what, Glenn stuck around, we've got to take a look. He's foregone a raise for how many years? He's making 75 and change. What does he deserve? Well, you know what, we should give him something. I can't tell you what this board would have come up with, but in light of what we see for his comparables,
Right.
I think we would have been north of 80,000. Now, if I throw the 15 grand down there that I would have paid them, I don't believe that I would have had 1 ounce of resistance if I said, you know what, we're gonna sign another contract with Glenn, and we're gonna give him 6,000, and then 2 more thousand a year each year after that.
Well, Glenn
So
was
now put-
also an
hang on,
employee,
hang on, let me
that
finish.
worked for us for 10 years, and he forgoed raises 8 out of those 10 years.
I appreciate it.
Of course, I would take that into consideration.
I appreciate that. So I'm saying if I'm at 75 and change, I brought a $6,000 raise, and then for years 2 and 3, we'll give them a couple grand each year. I don't believe we would have had any level of discussion that reached this point. So I'd have come to you and said, hey, I want to be somewhere around 81, between 81 and 82 for this year. Oh, and we got to throw in the $15,000 for healthcare. Well, that'll be 97. Nobody would have blinked an eye. Now I'm trying to say, well, I want to do the same thing. I just want to call it 97. And somehow we've completely changed. And I understand fiscal responsibility in comparison to other communities and all this other stuff, but it doesn't matter. I'm saying if I got $97,000 in the budget and I can spend it, this is the way I think is the best way to spend it. That's all I'm trying to say, and that's why I've brought it
the
up.
problem, the problem is, Ken, that your budget's in the red. You don't
No,
have,
it's
it-
not.
you don't have it in the black budget, you have it in the red budget.
Not true.
Well, you do.
No.
Sure you do. The last 3 years, the general fund's been in the red.
It's been in the black.
But you're assuming that you just have one candidate and you have to take that candidate. That's.
No, I'm not.
you-
No,
you're-
I'm
you
not.
are-
What I've
you
said
have-
is-
You have complete tunnel vision, Mr. Verkes, right now.
No, what I've said
You
is.
do. You do.
All right.
Could
Now,
I
whatever
ask-
this board does.
I ask one more question then. Did the conversation come up about the retirement portion of the contract? Like, if you were to offer a contract to the one individual, did the retirement percentage that you offered come up? Or did we say that this is the contract, 99,000, that's it? No-
We,
no
yeah, we talked
healthcare,
about that there was a
no-
percentage, but yeah.
We didn't talk about the specifics number. He has seen Mr. Spencer's contract, but we didn't say that's what it was, or there wasn't, I mean,
Because I'm just thinking there's a potential to say that that's not part of it. Here's the contract, this is what we're offering.
Well, yeah.
We haven't specifically said that.
We haven't named an amount. And again, from a comparison standpoint, we
Just-
talked about, right, we talked about a percentage contribution. But truly, we have not extended to the individual a
And
contract offer.
the only reason I
That's
say it is because I do contract work myself. My rate is included. I will take on these responsibilities, and that includes health insurance, that includes pension contributions. Those are all based on my rate, based on what I asked for. So
Right.
potentially, you don't have to offer that portion if the candidate is willing to take the set number.
Well, had Mr. Spencer stayed, and I threw out, say, you gave him a $6,000 raise, and I don't know that, but I'd thrown that out. Our contribution for this year would have been between $10,000 and $11,000 into that savings plan. So 82,000 would have resulted in a $10,000 to $11,000 contribution into a savings plan. As a reference. So if we use that as a percent of, I said, 98, 99, and 100, or 97, 99, and 101, whatever it is. It kind of, to average it out at 99. If you average it out at 99 and you took,
Well, anyhow,
it would work out to be about 11%.
once again, throwing everything around, I still think you take the conservative side of things, and that's just my opinion, and that's that. You know, and I get everybody's opinion here, but at the same time, people watching this, they're going, what are these people talking about? They have a qualified candidate, $80,000, and they're talking $110,000. I mean, I know if I was sitting at home, my head would be spinning right now.
Well, and again, the total cost is not $80,000.
And the board is, okay, so I'll say it, it's $86,000 or 80, what is it, for a single payer? 8,800, somewhere in there?
Okay.
8,000? Okay, so I'll say $89,000 total package versus
$99,000.
$99,000.
And I think that's what Bill and I
That-
said.
that-
Okay,
It would be
so I
85
think,
and
So
90.
Darren-
I think that makes my answer right there. I'm done. I don't
Okay,
need to
but
go
the
any
point
further.
is, we can't keep saying 80,000 because it is
That's what I said,
89,000.
88.
Okay, 80,
I-
let's call
I
it 80.
concede,
Fine.
88.
Right.
Perfect.
And so all I said earlier, and I won't say it again,
I've
is
candidate-
that if,
99.
okay. And we talked about whether or not there was any, and your point would be to hire the lesser cost candidate.
Correct.
And so it's about cost, not about the qualifications.
Well, I'm saying the qualifications are
You're saying, you
Relatively
believe
the
the
same.
qualifications
Relatively
are
same,
equal.
okay, and my point would be.
quite honestly, I think John is more qualified.
Okay.
Reading the resume.
All right.
Okay.
But I'm either candidate I'm gonna have to work with, so I'm not trying to burn any bridge here.
Okay, and
At
I'll,
the same
and
time.
I'll make my point one last time and be done, that if the candidates are reasonably qualified, I'll defer to the direct manager at if it were 90,000 all in. That's,
And I agree with that.
Yeah.
I think I said the same thing, 85 to 90,000 is where I'm comfortable.
For the total pay, all right.
For
total.
total?
So then we're
Yeah,
saying the
but
same thing. So
but
we're
again,
saying-
I mean, let's keep in mind,
See,
we were
see,
paying
we're talking
90,000
different.
and
I
the
am.
guy deserved a raise, so now we're saying, we're only gonna replace a CPA with someone who's willing to work for less than the last guy was, even
No.
though he's
Yeah,
the lowest
I don't
guy
think
on
you're
this
hearing me.
list.
I don't think you're hearing me, but
Okay.
that's okay.
No, maybe I didn't. That's what I'm saying. Help me to understand. Are we only gonna hire single guys so that our insurance is
No,
less?
that's
How
not
how
what
do we
I'm
get to
saying. I'm
90,000?
comfortable with 90,000.
Of
So total-
salary?
Total cost of employment or salary?
Total cost of employment.
So
Right.
that's
But-
$75,000
That's
for a
literally
wage.
less than what we were paying Glenn. And when we posted that, we had one applicant.
Okay.
Yeah, and again, I obviously have a preference in who we hire.
Right.
I mean, if you wanna extend an offer to him for 90,000, that's great. I wouldn't extend any other offers to anybody else.
I make a
That's
motion,
that's my personal preference.
I'll make a motion to extend an offer to John Mudzinski at $80,000 plus health care, or for a compensation package of 90,000. If you wanna give him 83,000
It's your
plus the
motion.
$9,000,
It's your motion.
I'm fine with that, right, because it's a single payer. However you wanna.
Don't ask however I wanna do it, cause you're
Okay.
making the motion. I'm
Okay.
not making the motion.
I'll make a motion, to extend an offer to John Mudzinski at $80,000.
And what, $80,000 salary?
$80,000 salary, and he has to have health care, obviously.
Well, but complete your.
Obamacare, you have to have health care, and you have to have with the rest of Glenn's contract. $80,000 plus Glenn's contract is about
Well, that's good though.
88,000 plus
88
the,
during the other contract. That 80 plus the contract, that's fair.
Correct.
For how many years?
well, I think you need to do a probationary period for 6 months. What do we
No,
know?
how, what length of the contract, I mean, is it
I would do-
10-year contract or
I would
1
do
year?
2 years with a 6-month probationary period. I think there has to be a probationary period with any person we hire. We've always done that with Glenn, with building officials. I think the supervisory contract even has it in there, isn't it 6
But
months?
this isn't a supervisory contract employee.
Well, I understand that, but I'm just
So
saying that's
80,000
our
plus,
standard practice, but, sometimes things go out the door, I get that.
so your motion is 80,000 plus, plus the contracted benefits that are in Glenn's
Correct.
contract.
Yes.
For 2 years plus an extension of 2 years?
No, I
Oh.
said 2-year contract with a 6-month probationary period,
I'm sorry.
which is what we would offer anybody.
All right, is there support? Was there support? Motion fails for a lack of support. Is there another motion?
Make a motion to table this matter. I don't.
No, you know what?
Well, I
No,
don't know.
there's no tabling. We gotta have direction. We've got a
Well,
position that's
Well,
open.
everybody can't be quiet. I mean, if you don't like the one motion, come on. If somebody wants to pay someone $100,000, come and say it.
I would, but I
Have at
can't.
it. Here, I'll
Adam-
take the chair.
Adam, can you give me the figures that were in the previous meeting? I think it was 99.
This is exactly why this
99,
township's in this trouble it's in.
I'll make a motion to hire Dennis Clark for a 3-year contract of $99,000. Yep,
Outrageous.
with no healthcare benefits included.
3 years, you said?
Yes, sir.
All right, we got a
No step
motion,
increase?
No step increase.
got a motion by Mr. Cap.
Probationary period?
Same probationary period as the last motion.
Okay. Okay, got a motion by Mr. Capro to hire Mr. Dennis Clark for a salary of $99,000 a year with no health care for a 3-year contract and a 6-month probationary period. Is there support?
Support.
Support by Mr. Witt. All right. Well, is there any public comment?
Jim Sunstock, 31698 San Juan. I sat through this whole thing here tonight, and I'm disgusted. If anybody has tunnel vision, Mr. Verkest, it's you. And the reason is because you made the initial contact with this guy. He's your buddy. He's worked with you for years. Mr. Caprali's a friend of yours. He's worked with you for years. How convenient that you made this motion. I listened to what we had, and the job qualifications are basically that you're going to have 2 employees and 1 finance director, and they're going to be doing an a hands-on type of operation, which is what Glenn did, and I appreciate what Glenn did. It's amazing. So I'm sitting here listening to this, and basically, one of the requirements, the most important one probably, is BS&A. You got one candidate that says he has no experience in it. You have a finance director that recommends another guy. And you guys sit there with your tunnel vision. Oh, wait, he's a friend of mine. I'm going to make sure I get him in. The person that you hire is going to be responsible for the operation of the department. The buck's going to stop there. It stopped with Glenn, it's going to stop with whoever he hires in. I'm listening to you talk about these people or listen to what they had to say. One guy's represented 3 cities where he was the city controller or the finance controller. He was the top dog. The buck stopped there. He handled all this stuff on hands-on basis. The other gentleman, and nice as he might be, belongs in the 3rd largest city in the county, in the state, and he basically had a department of 12 people, and essentially he did nothing of his own. He doesn't know anything about BS&A. He's a generalist, is what he is, and there's nothing wrong with being a generalist if you work in a big community. But that's not what you guys have here. You have a small community. And then on top of it, I'm sitting here listening to you guys, and you're going to pay him more money than what the other guy will work for. Disgusting. I'm glad this is being televised to the people because it's just indicative of it's not your money. Let's just go ahead and we can spend it any way we want. We can get our friends in. It's the old friends and family. And to tell you the truth, it might even be church. And I'm sick and tired of it, and the citizens are sick and tired of it. You people are basically running this like a little fiefdom up here. Go ahead, make your move. You'll pay for it. Thank you.
Thank you. Seeing no other public comment, we'll close the floor for public comment and move back to board comment.
I want to make it really clear that I have nothing against Mr. Clark at all. I'm just going with the cheapest guy, and Mr. Sunstock does bring up a point. And every person we've hired before this, if you didn't have BS&A experience, we kicked them right out the bucket.
That's not true.
That's.
Glenn did not come in with BS&A experience.
But when we're doing our interviews, that's the first thing you 2 say. Oh, no BS&A, we're not hiring him. No
That's
not
not
the
true.
first
I
thing.
can think the last 1, 2, 3, 4, 5 people that we brought in to the township had 0 BS&A experience. Your deputy treasurer didn't come in with BS&A
You're right.
experience.
You're right.
So if it's so important, why'd you make that mistake and hire Mr. York?
No.
No, you said it is
that
the
isn't what I
utmost.
said.
No, you said it was the
Adam,
utmost important thing when we
Adam,
hire people.
No, what I
Hey,
said
guys,
was.
hang on.
What I said
Hang on.
was.
Hey, hold on.
When
Hold on.
we're in the
Mr.
interviews-
York.
When we're in the interviews, the very first thing that you say
Mr. York.
is that
we're not going anywhere here. This is an argument, guys, come
No,
on.
no, I'm trying to
I understand, but we're
where you're at.
arguing.
I'm trying to understand where we're at. Because every time we get on a consistent basis, all of a sudden it changes. We sit in interviews over and over and we're picking people, they don't have BSNA, we don't want them. I've always said that we can train people on BSNA. That wasn't my most important item, right? But you two have always said that is the most important item.
I've never said that.
never said that.
I have
All I'm
never
saying
said
is,
that. I
I'm
mean, this
trying
is
to figure
ludicrous.
out, I'm trying to figure out where we are when we're hiring people, because it changes with every person we hire.
Well, let me ask you this. Who was the last person we hired that came in with BSNA experience?
Wasn't it,
Wasn't Paula,
well, we
wasn't
interviewed,
Martha,
well, we
wasn't
interviewed,
Kathy.
we interviewed people.
Wasn't
and-
Brad.
And there were people that I wanted to hire, and other people wanted to hire, but you said, no, she didn't have BSNA experience, and I'd have to go back and look.
But who
It
was the
doesn't-
last one then?
It doesn't even matter at this point, I'm just saying.
But you said
that
it does
those are
matter.
the discussions that we've had when we're hiring people. And I don't understand on any level.
Okay.
How you can say that Mr. Clark has more experience than Mr. Modzinski when it comes to running the community, when he's run these small communities. That's all that I'm saying.
Fair enough.
And Glenn felt the same way.
That's not what Glenn said. Glenn said on paper, he looks like a good candidate, that he does what I do. On paper. Never met the guy, never talked to
I
him.
understand.
So, but don't put words in Mr. Spencer's mouth that he endorsed a candidate.
I don't think it matters what Glenn thinks
It
anyway.
doesn't matter at this
'Cause
point.
Glenn-
Take,
Glenn's
you
retired,
know what?
so.
Take your vote right now, and let's just be done with it.
I presume you,
I-
are there?
I want a
bo-
roll call,
I would-
absolutely.
Right, I presume you wanted a roll call. I was gonna ask that, if there's more board comment.
I was gonna add some more board. Dennis, Mr. Clark is my favorite. After interviewing the two candidates, I believe that Mr. Clark is the most qualified. I feel like he has the most experience. I feel like he's a leader, and he has the ability to learn BSNA probably in his sleep. He's been exposed to it. This is accounting that we're talking about. This isn't really,
Yes, this is an intricate computer
extraordinary.
programming.
Yes, this is basics, line column software. It's probably all the same. I've never used any of it, but I'm sure it's probably all pretty similar. So I'm sure that Mr. Clark is qualified for the position. My only reservation is the amount of money that we're talking about. And that's where I was alluding to before. I'm comfortable with high 80s to 90,000. That's what I'm comfortable with. And I'm not talking about anything beyond that. I'm comfortable with high 80s to 90,000. Outside of that, I think he's the most qualified candidate. It was pretty evident to me after interviewing the two people.
And.
Although I appreciate
We don't need to go
Mr.
through it again.
Spencer's opinion, I don't think it matters.
Right.
You got a
and-
motion,
hold-
let's just vote, please.
Hold on. So I, as a board member, I'm not allowed to comment.
Well, you're gonna say the same thing that you said 10 times.
Wow.
Well, that's all I had to say.
Okay. I would like to point out to you that I appreciate more than I believe you know the fiscal responsibility. I only want to translate what you just said to me, because in a moment, we're going to take a vote on this.
Right.
And either a majority of the people will approve this, or a majority of the people will vote no. And as I've said all along, I'm good with either answer. But if the answer is a no, please don't ask me to go out and find a candidate for a total cost of wages and benefits of $90,000, because I've already tried. And we got one, and no one was even willing to second the motion to hire that person. $80,000 was what we advertised. Single payer, which is the cheapest insurance, was $8,000. So that cost of wages and healthcare would have been $88,000, right in Mr. Brado's range. And no one was willing to second that, and he was the only candidate we received. So if the vote that we take right now is a majority no, I'm okay with it, but please be prepared for the next question, and that is, board, how do you want me to fill this position? And I'm assuming that it's gonna be, you're gonna have to post for the position. And then I'm gonna ask the next question, what salary range would you like to post? Ignoring benefits. And if it's 70 to 80 plus benefits, I'm probably gonna get the same pool that I got, which were people who were working in municipalities as that accountant one, accountant two person. Not a person who has experience or is prepared to run that department. Now, if you say, look, you went 70 to 80, this time let's go 80 to 90. Well, I gotta tell you, if I fill out that job application, I'm looking at the 90 number. Maybe not when I come through the door, but 90 is what I'm expecting. And once I throw healthcare on there, even if it's a single guy, I'm at 98. And if it happens to be a family man, now I'm at 110,000. So now I'm 8 weeks down the road, at best. I'm gonna be in the meantime asking you to hire someone on a temporary basis or to pay an accounting firm because we can't wait 2 months before we fill this position. And in the meantime, I may be back before you saying, hey, we had a candidate before and we all agreed that we liked him, but now unfortunately I'm gonna have to ask you to say, I've got this next candidate, but he's at $110,000 total cost for wages and benefits. Maybe he's good at 85, and if he's got a wife, now he's at 100,000. So my point is while I appreciate the fiscal responsibility, I'm asking you to realize that the total compensation package that we're proposing here is likely what we're going to have to propose to fill the position, whether I like it or not. And further, when I look at this, I certainly can't tell you of these 5 communities what those people are getting as far as single payer, 2-person, or family health care. But even if I put 1-person coverage on each one of them, there's only one of them that's less, and more of them are above what we're proposing to pay. So we've got to be realistic when we say 99, that's what it's going to cost us to offer a job to someone, and you've got to also realize that a vast majority of those candidates are going to want health care. So the best we're going to do is find someone who says, okay, I'll take it for 90, and I'm a single guy. All right, we're at 99, 98. We saved $1,000. But we run the risk of that person coming in saying, hey, you know what? Regardless, I don't care if Shelby's bigger or Chesterfield or Washington's about the same. You know what? They're doing the same job I'm doing, so I'd like to be in that salary range. So I'd like something around 90,000. Oh, and I've got kids. So that's going to be 110. So fiscally responsible at this point is to look at the budget, at the total package. So I'm okay with the roll call vote, and I'm okay with however you vote. But if the vote is no, when we're done, the next question I'm going to ask is, how do we fill this position? Who do we pay on a part-time basis to fill in? What issues are we going to miss out on in this interim, which we can handle? But then what am I going to post to fill this position? And if it's a salary range of 80 to 90, I'm telling you we're going to be back talking about the same cost or greater.
Mr. Supervisor, first of all, I want to say, I think the hiring manager should make a decision on the candidate. Not that this was not productive this evening, but you know what, and I've said this as long as I've been here on the board. The hiring managers need to hire. So I still feel that way, and I feel that way tonight. I guess my second question relative to the motion is, have you asked the candidate of your preference if he might accept 94K at this point? I mean, the whole thing is, you guys talked about a number, but in lieu of the discussion, you know, I guess I'm wondering if he's willing to be flexible. We are in a money crunch. We do have some issues with budget, and this could be a good compromise. It could be a good relationship builder. I think it's, you know, before we make a motion, I would feel comfortable with 94K, quite frankly, $5,000 less than that the motion stated.
Mm-hmm.
So I would feel okay with that, and I think that would sort of be a win-win situation. So that's my comments.
Well, so in response to that, I would defer to Mr. Witt, because you're asking the chair. When I met with Mr. Clark originally to see if there was a feasible option, and he told me what his current compensation was, I was pretty quick to say, well, that's not gonna work, because I'm not gonna bring a salary of $100,000 back to the board. However, when he said, I do receive health care, and I looked at what that cost of health care was, then I became more interested to say, okay, what could we do? So we talked in generalities. Mr. Witt probably had greater conversation, but again, we didn't say this is the offer, this is the number. We said, what are you looking at?
The conversation was more so with Mr. Clark just to say, what are you thinking? So that when I came to the board, and because it's an unorthodox way to pay this person based on how we've done it in the past, I said, what does it take to get you in? So I had something to bring to this board. I mean, if it was something within the range, I wouldn't have had to ask the guy. I would have came to the board and said, hey, what do you want to pay him? You know what I mean? So that's why I had that conversation, just to get a
And
ballpark.
I get that.
So I didn't have negotiations
Yeah.
with them. And
Okay, I understand that.
Sir,
But I
would
can
you
tell-
take
I
the
can
job
tell-
at $94,000? I'll just ask the question. You can answer the question and save us another hour.
I would think about the job at 94 if it was a $2,000 raise per year.
So 94, 96, 98.
You know, we're negotiating for the person and the person sitting right here, you know.
Well, but I think- I
Doesn't
think
bother me.
it's what we
Mr.
were
Huth
trying-
isn't big gaveling us.
It's what we're trying to get at, though. I mean, we had,
Person's sitting right
we had
here.
talked
Yep.
about making, doing some type of board consensus, building a consensus.
Absolutely.
I think that Mr. York, I don't want to put any words in your mouth, sir, but you were saying that you could work with either candidate, right? And the stumbling block was the money.
My
Right?
only
I mean,
stumbling block.
And it sounds like that's general consensus, so.
Well,
Well, I think-
we have
I
a
think-
motion.
I
We
think
either
this-
follow that motion or we modify that motion at this point.
Well, don't we have a second? We have a motion.
Yeah, it's
we have
been,
a
it's
second.
been, yeah, but I mean, I can't change that motion.
Based on what the candidate said, I'd be willing to change the motion to 94,000, 96,000, and 98,000 based on 1, 2, 3 years.
All right. Mr. Witt, is there still support?
yes.
All right.
So I guess my feedback and my comments at this point, again, would be, I feel comfortable at 94 with $1,000 a year raise. So 94, 1,000, 1,000. My comments.
or
You know-
since, go ahead.
We're in a crappy position because, again, we're sitting in front of the person trying to negotiate a contract.
Well,
We'll get it done.
Just
Okay,
let
go
him
ahead.
finish, let him finish. Jeez.
You know, I mean, at the end of the day, you're talking $1,000. I mean, that's a pride point. That's not.
No,
That's
no,
not
it's
save the
it's
budget.
not. No, it's not.
It is. It is. I mean, it is.
It's money that's being saved.
It is, but
And if
in the
you're
grand
talking
scheme
about
of
somebody
things,
who's
it's a
going
rounding
to,
error.
talk to somebody who's going to be part of our organization, going to be, individual contributor. I mean, so, just like Glenn did, made concessions.
Sure.
We're trying to, and again, you don't have to vote for it. I'm just, this is a
Absolutely.
comment. We have a motion, so this is a comment.
No question about it, and
Okay.
it's fully
So
fair.
it's
I'm
just for
not, yeah, I'm not gaveling you. I mean,
Yeah,
it's just,
I mean,
he's has a comment as well.
Yeah.
we're not Warren. I mean, we're a small community and we have some budget issues. And that's my only stumbling block with this position is the salary, so.
Well, I see this as a concession. I do, and I see this as someone who's agreeing that in year 3, they'll be making less than they're currently making. I think that's a genuine concession. Now, that doesn't mean that you have to hire this person, but, again, if the answer to this is no, and we're not at 94, 96, 98, I'm gonna go out there and I'm gonna say, okay, who am I gonna get for 96 for?
Well, that's why
Wages and
you have
healthcare.
the gentleman right here.
But again, if he
Okay,
had
so-
said,
so-
you know what, tomorrow I'm getting married, and guess what? She has 3 kids.
Right, that can happen.
I know, but what's your cost of doing business then?
It-
It's more than what we're
That's why I don't
proposing.
That's why I don't include the healthcare.
But you
'cause
have
it
to
can
include the
change.
cost of doing business.
All right, we've hammered that out. We don't have to
Yeah,
go
I
back through
mean,
it.
it is what, I mean,
Do we have any new board comments?
I'm trying to move it along.
Okay. If there are no more comments, we have a motion by Mr. Capral with support by Mr. Witt to offer the finance director position to Mr. Dennis Clark for a starting salary of $94,000 in year 1, $96,000 in year 2, and $98,000 in year 3 with no health care. It's a 3-year contract with a 6-month probation. Mr. Witt, will you please take the roll call?
Yes, Mr. Capral.
Yes.
Mr. Witt, yes. Mr. Batanti.
Yes.
Mr. Brado.
Yes.
Mr. Tominello.
Yes.
Mr. York.
No.
Mr. Verkest.
Yes. All right,
Well,
do you
it took us
accept?
an hour and a half to get there.
All right, good. Well, thank you
Welcome
very
aboard.
much. Thank you. All right. We have a closed session, but I'm just gonna call for a short recess, if that's all right, while we get ready for our closed
Well,
session.
why don't we make a motion to go into closed session, then we can just shut it down?
Well, that's
Why
fine
do a
too.
recess? Why
We
don't
can do
make a
that?
motion,
Make a
and
mo-
make a closed session,
So-
and then shut it
Make a
down?
motion to go into closed session at 9:18.
All right, is there support?
Don't you have to say what you're discussing?
Oh, I'm sorry.
Attorney opinion.
Yep, attorney opinion. Okay, at 9:18, is there support?
Support.
Doesn't it have to
Support.
be attorney opinion, blah, blah, blah? The city of Northville case, I'm just saying, you have to
Attorney
say,
opinion regarding Aaron Hardcastle.
thank you.
Okay,
Better yet.
we've got a motion by Mr. Tominello to go into closed session regarding
Support by Mr. Cap.
support by Mr. Capel. All right, any discussion? We'll open up the floor for public comment.
Yeah, what was the reason?
Discuss an attorney opinion regarding Aaron Hardcastle.
My understanding is that the lawsuit that was involved with Aaron Hardcastle has already been concluded. You have no pending lawsuit concerning that item, and as a result, you cannot go into closed session.
I agree, you cannot go in closed session to discuss pending litigation, but the Attorney General said that you can go into closed session to discuss communications that are privileged and protected by law, including an attorney opinion, and it's appropriate. Any
Well-
decision made regarding Aaron Hardcastle will be made in open session.
Yeah, like they come out in open session and say, oh, we make a motion to do what we talked about.
No.
The fact of the matter is, you are required to not go into closed session for that kind of an item. Is it a pure, have you had a written, because I will be asking for the written opinion to this board after you come out of closed session. So do you have it with you? Because you're saying it's it's an
And
attorney's
Mr.
opinion.
Sunstock, I think in good faith, Mr. Huth tried to answer your question, but this is public comment. This is not,
All right, I won't ask him the question, I asked the chair. You guys are violating the law. You guys seem to
Well, it's not a
forget.
question, that's
You
a
seem
statement.
to forget that I stood up there in that same seat you are, Mr. Verkest. I know what the law is just as well as anybody else. We had Bob Vickery there saying that you couldn't do that. We had other board members that like to go in and have little private conversations concerning something that should be discussed out in the public. And they attempt to put it in a closed session, and it's illegal. So I'm maintaining you are not following the intent of the law by going into closed session for that purpose. If you'd have no pending lawsuit with Aaron Hardcastle, that's why I ask who it was involving, you have none, then any discussion you have concerning Aaron Hardcastle has to be done in public. Unless she asked that it be done in private, and it has to involve disciplinary matters. So if you guys want to violate the law, that's fine. I guess we're gonna get to the bottom of it, because the citizens are gonna be really interested to know what you're talking about and why it's so secret. So I've raised my objection, I've put it on the TV, I've also made it to you and to you. And if you guys go into closed session, be prepared for a challenge with the prosecutor. Thank you.
thank you.
You know, I have to say that.
Hold on. Seeing no other public comment, we'll close the floor for public comment and move back to board comment. Keep in mind that the motion at this point is to enter into closed
I
session.
understand.
I'm just
I
reminding.
had called Mr. Huth this afternoon, and being on the board for a long time regarding these closed sessions. If this is what I think it is, and I haven't received anything on this, I'm just going back to a conversation we had a month ago or whatever. If that's what it is, I'm gonna have to agree that I think that this is an improper closed session, and I'll see what it is when we get there, but I had talked to Mr. Huth this afternoon, and he did say that he felt it was, but I've never been in a closed session where it's just an attorney-client privilege item before.
Okay. Well, I certainly did contact both our labor attorney as well as our township attorney before I'd asked for a closed session, so I do believe, based on their advice, that it is an appropriate one, but,
That's fine, I just, I don't know, you know what it's about? I don't.
I think there's one attorney in the room.
two.
Two?
Two, we got an extra one.
Oh, great, okay. Two attorneys in the room. Okay,
Alright.
well, I trust Mr. Huth's advice.
All right.
So,
All right. Any other discussion? Well, it ain't 9:18 anymore, but we have a motion by Mr. Tominello with support by Mr. Capital to enter into closed session to discuss Aaron Hardcastle.
Attorney's opinion.
Attorney's opinion regarding Aaron Hardcastle. Mr. Witt, will you please take the roll call?
Yes, Mr. Tominello?
Yes.
Mr. Capral?
Yes.
Mr. Batanti?
Yes.
Mr. Brado?
yes.
Mr. York?
Yes.
Mr. Witt? Yes. Mr. Verkust?
Yes. All right, good. We'll take a little recess before we get started here.
You know, it'd be nice if those are looking pretty thick, if we had a copy.
They're not thick.
Oh, all right. For closed session.
This person's Glenn never make an offer. You give him fucking healthcare and he's happy. It just is. I mean, it's the same difference.
No, but I think this is.
Good? All right, be looking for a motion to enter back into open session.
You know, Mr. Huth didn't check and see if there was anyone out there.
Oh,
Sorry,
that's good.
just before we get too far.
Fall down on the job.
I know.
Yeah.
I was already stating I could have done.
No, that's his job. He gets angry if you take it.
I'll make a motion to enter into open
I missed
session
that, that was funny.
at 10:18.
There's support. Support?
Support.
We have a motion by Mr. Tominello, a support by Mr. Capital to enter into open session. Any discussion? Hearing none and seeing no public comment, Mr. Witt, will you please take the roll call?
Yes, Mr. Tominello?
Yes.
Mr. Capral?
Yes.
Mr. Batanti?
Yes.
Mr. Brado?
Yes.
Mr. York?
Yes.
Mr. Witt? Yes. Mr. Verkust?
Yes. Is there a motion from closed session?
I will make a motion to accept the offer to,
Settlement agreement?
the settlement agreement offer, paying Ms. Hardcastle an amount of $52,525.35 and healthcare through January of 2017,
With a release.
including a release of all claims.
Good?
Yep, good job.
Motion by Mr. Witt. Is there support?
Support.
Support by Mr. Capital. Is there discussion?
Use your roll call.
Hearing none, and is there any board comment? All right. Mr. Witt, will you please take a roll call vote?
Yes, Mr. Witt, yes. Mr. Capral?
Yes.
Mr. Batanti?
Yes.
Mr. Brado?
Yes.
Mr. Tominello?
Yes.
Mr. York?
No.
Mr. Verkust?
Yes. Motion carries. Thank you, board. Is there a
Make a
motion to
motion to
adjourn? All right, is there support? Support. All in favor?
Aye.
Aye. Opposed? Motion carries. Meeting adjourned. Thank you, board.
Put me down tonight, 10.
Yes.
Thank you, Catherine. What could be better on a Friday night, huh?
I don't know, Ken, you're pretty lucky because they're probably not serving food anymore.
Oh, you're gonna offer me lunch?